New batch of COVID vaccine appointments this morning. As we've been telling you, we're gone in minutes and here to answer your questions about that and so much more. Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Doctor, thank you so much for joining us as you do every week, and we truly appreciate it. For months, you've talked about it. There's a lot of worry that people would say, I'm not sure I even want to get vaccinated. But so far, obviously, based on all of these stories we've been doing, public reaction seems to be the opposite. The shots are hard to get. Demand far outweighs supplies. So in your opinion, and this might frustrate some people, that part of the rollout is successful to you, correct?
Definitely. You know that we're one of the leading states for first dose vaccinations. I think most Massachusetts residents, Maria, realize that the COVID vaccine really represents a ray of hope and light, and that by driving down transmissions, that this will ultimately lead to more survival, better health, and really personal and economic freedom. So, we just have to keep, charging forward like we're doing.
Indeed. So, Dr. Ellerin, state data shows 8.5% of our population has been fully vaccinated. 18.6% has received one dose. Are those numbers high enough yet to have any impact on new cases?
Erica, I do think that it's a combination of what's driving down the virus right now. I do think increasing immunizations are helping. Also, remember, there's been over 500,000 natural infections in Massachusetts. Those are confirmed cases. We think there's about 3 to 4 times more unconfirmed cases. So that could be about 1.5 million to 2 million. Those things, along with masking, distancing, and part of the seasonality of the virus, I think all of this is driving down the virus, and hopefully that will continue. Remember, we still have to watch for that variant surge, however.
I just want to clarify something and just say that the frustration that I was alluding to is that people are trying to get these shots and they're just having such a hard time doing that because of all the supplies. So there are new efforts around the world, doctor, to deliver one vaccine dose to more people, even if that means delaying a patient's second shot for weeks, maybe even months. Germany just approved 42 days between the first and second dose of the Pfizer vaccine. Canada deciding whether to extend the interval to 4 months between each shot. Do you think a change like that could solve our problems? And what is the risk waiting so long as that spreads out?
It could certainly help. Right now, remember, these decisions right now have to be made by the COVID Command Center, right, as part of the governor's task force and the Department of Public Health. But think about this. Scientifically, we think that the further vaccinations are out between the first and second dose, actually the immune response tends to be the same, if not better. The CDC says it's okay to wait 6 weeks before the first dose and the second dose. I think that's very reasonable. Also, the UK is currently spacing out its vaccines 12 weeks. That's with Pfizer and the AstraZeneca Oxford. And so far, they've been seeing very positive results. So what is the downside? The downside is that there's been concerns you've heard from Dr. Fauci to say maybe we're going to allow partial immunity and leading to more variants between dose 1 and 2. You never like to disagree with Dr. Fauci, but I think in the end, because the demand far exceeds the supply, I do think we're ultimately going to have to extend doses beyond 3 to 4 weeks. We'll have to see how far that is.
Interesting.
Well, and Dr. Ellerin, you've said that people who've recovered from COVID-19, they should still get vaccinated. Do they need both doses?
So, say that one more time, Erica, sorry.
No worries. So if someone has recovered from COVID-19, would they be a person who could just have one dose?
Right. So here's the thing. There's small data sets that suggest that there's a great boost with a single dose after infection, okay? And that's important. I do believe that most patients will be okay with a single dose, but still, the important take-home message is official recommendations are still to give two doses after natural infection.
Dr. Todd Ellerin from South Shore Health, Chief of Infectious Diseases. Thank you so much. We appreciate it, doctor.
You too.